Hello and welcome to our presentation. My name is Dr. Kateryna METERSKY and I'm going to be presenting for you today. We know that an adequate skilled workforce is fundamental to an effective healthcare system. For more than 4 decades, Canada has experienced a chronic shortage of nurses, and nurses are leaving the profession due to burnout, poor working conditions, and heavy workloads that compromise the ability for them to provide good quality patient care. Particularly the pandemic made the situation worse, and some governments responded by recruiting internationally trained nurses and increasing enrollments of nursing students. But the issue still remains that we must find effective ways to retain new graduate nurses instead of feeding new nurses through a revolving door problem. So the aim of our study was to identify strategies that prevent burnout and massive resignation among new graduate nurses. This was a qualitative exploratory pilot study where we recruited 15 participants via online convenience and snowball sampling. We conducted 4 60 to 90-minute virtual focus groups with semi-structured interview guide, where we also used the Social Ecological framework to examine new graduate nurses' experiences at multiple levels during the data collection process, as well as using the intersectionality framework as a method and disposition to interpret the findings and analyze how new graduate nurses interact with and resist against prevailing structures of power within nursing. Our inclusion criteria was nurses who were 22 to 35 years of age, graduated from a Canadian School of Nursing, wrote and passed their licensing exam, and are currently working as nurses or registered practical nurses in the Greater Toronto Area acute healthcare settings. And our results pointed to 4 key themes, which are listed for you on the slide, and I will walk you through each one of them in subsequent slides. For this first theme, new graduate nurses expressed that the push to leave acute care nursing begins before they get a chance to really start their nursing careers. The discouragement begins during their nursing education in university and specifically with inadequate clinical practice experiences. A quote from our participant number 12 stated, "During my 4th year, I had a virtual semester where we did simulations online. I kind of felt like I started from nothing," as an example for this theme. The second theme talked about preparedness, orientation, and mentorship during entry to practice. Particularly, one of our participants shared, "I was ideally supposed to be with 2 different mentors. I actually ended up being paired with 20 different nurses altogether. As a new graduate, I felt alone a lot of the time. I had to figure out my own problems a lot." So this theme really spoke to the challenges they had during onboarding at the particular hospital. The next theme talked about navigating transition to independent practice and multi-level structural violence. As an example from our participant number 5, we really don't have any middle seniority staff like these people that could become good mentors. So that lack of having senior mentors or those with extensive experience was missing for these new graduate nurses. Another participant said, "Coming into the intensive care unit, a lot of the more experienced nurses weren't welcoming, or they frequently talked behind your back. They would give you the toughest assignments to kind of let you again experience, like a trial through fire." So that nurses eating their young element was really evident in this particular theme with our participants. The next theme was perspectives on professional trajectory for new graduate nurses. Our participants talked about that there isn't very much career progression when it comes to being a nurse. "I think the new generation is realizing that you're physically tired, you're mentally tired, and emotionally tired." So they talked about what are those opportunities that are available for them when they are experiencing such extensive burnout on their unit and in their current nursing practice. So having reviewed the themes we identified, in conclusion, for nursing education, we need to consider students' self-evaluations, having consistent preceptors, and increasing hands-on learning opportunities, and not cutting them short, as we have found in our study those to be vital for successful retention of nurses. In terms of organizational support, we need to think about flexible ways of working and reevaluating how we conduct nursing and clinical nursing practice. We need to have comprehensive and extensive orientation, as well as professional development and educational opportunities for nurses. I wanted to thank you so much for listening to our presentation. At this point, I do also want to share my contact information in case you want to dialogue about this work further. And here are our references. If you scan the QR code, it will take you to our list of references. Thank you, and I look forward to interacting with any of your questions and comments.